Hello viewers, I'm Dr. Chandra Sekhar, Orthopedic Consultant in Care Hospital, Banjara Hills, Hyderabad. Today we will get to know what common orthopedic problems children can suffer with. Generally, children can present with non-specific bone and joint pains. Usually we call them as growing pains. The other types of conditions they can get affected with are any congenital problems which can lead to deformities. For example, club foot, which is a deformity of the foot, or sometimes deformities around the knees like knock knees and bow legs, etc. The other common conditions are related to any injuries which can happen during playing and can lead to what we call as green stick fractures or simple sprains, etc. Rarely, children can also suffer with infections in the bones and the joints, what we call as osteomyelitis if it affects the bone, or septic arthritis if it affects the joint. This is in nutshell about the common orthopedic problems. So depending on what problem the child is suffering with, it's important for the clinician to take a proper history, do a clinical assessment and do the relevant investigations. Most of the time, these conditions can be identified on plain radiographs. With regards to deformities, it is important to assess the extent of the deformity and how much of functional limitation child is having. So, depending on the severity of the problem, the clinician will recommend either using splints or other kinds of exercise regime, and occasionally surgical correction may be required if the deformity is very severe. With regards to the trauma, depending on the type of the trauma, the treatment is decided. If it is a simple sprain or a minor green stick fracture, most of the time these fractures can be dealt with non-operatively with splints or casts. Occasionally, in a very severe displaced fractures, surgical intervention may be required. With regards to infection, which is a very serious condition affecting the bone, the patient should be treated under supervision with either antibiotic therapy or surgical debridement of the infected bone. With regards to growth pains, most of the time these are all transient conditions, and the child and the parent needs to be reassured regarding the benign nature of this problem, and most of the time these pains will disappear when the child grows into an adult. So at the same time, we have to rule out if there are any other serious problems. The serious conditions which need to be kept in mind are the infections and very rarely tumors, because there are certain tumors affecting the bone which are exclusive for children. If the child has a constant pain, and if the child suffers with night pain, or if the child is having any systemic complaints like fever, loss of weight or appetite, this has to be taken seriously and immediate attention of the clinician should be sought. Thank you.